Regardless of where we're from, whether we live in an urban, rural, or suburban setting, and regardless of our ethnicity, we come from a variety of cultures and can all call Minnesota home. People are products of their circumstances and cultures. Cultural beliefs and practices play a significant role in how diverse groups perceive health and illness, and subsequently, treatment and prevention. To meet the needs of Minnesota's diverse populations, health and human services organizations are increasingly turning to community health workers. Community health workers are critical links between cultural communities and the state's healthcare and social service systems. They can help close the gap between the state's growing immigrant and refugee communities and the medical services they need, not just to survive, but to thrive in their new communities. Community health workers are typically bicultural, bilingual, trusted members of the communities they serve. Although they often work in clinics, their jobs take them outside of a medical setting and into the communities and homes where their clients live. This program will introduce you to several community health workers. You'll hear about how they make a difference to the community members they serve. You'll learn about what their employers have to say about how they improve health in cost-effective ways. And you'll find out how they can train for their unique bridging role and at the same time build a health career pathway here in Minnesota.
Put the strip here.
The need for community health workers is great. Their clients are often disconnected from the medical community or are very new to our healthcare system. Community health workers help them navigate the system, make appointments, arrange for transportation, and better understand the importance of prevention in maintaining good health. Without such guidance, many clients simply go without the care they need, or seek care much later than they would have with the help of a community health worker. Language and transportation can rank high on the list of barriers faced by immigrants and refugees in search of medical treatment. Other barriers include low levels of health literacy, lack of trust and understanding of our medical care system, and lack of health insurance. All of these are issues CHWs help address. A happy, healthy, thriving community is what community health worker Sheena Loth is striving for. Sheena and her husband were the first Cambodian family to arrive in Rochester. She remembers the barriers they faced when they first arrived nearly 3 decades ago, and she wants to ensure that new arrivals more easily connect to the services they need and to other members of their new community. Sheena recalls how early one morning she received a call from a client who wasn't feeling well. As a CHW, Sheena isn't trained to dispense medical advice, but she provided life-saving support by initiating a 3-way call with her client and a nurse, and talked her client through the steps she needed to take to receive emergency services. Sheena's actions were vital in prompting the treatment of her client, who was in the early stages of a stroke. It's not uncommon for low-income or uninsured people, or those who aren't familiar with the healthcare system, to wait to seek medical attention. This can result in higher costs and poor health outcomes. CHWs help their clients understand that seeking preventive care and timely treatment promote good health while lowering healthcare costs for all. Healthcare professionals, such as Dr. Paul Erickson, medical director at North Point Health and Wellness Center in Minneapolis, see the CHW as an important liaison to the patient. They add value for both the client and the provider because they bring cultural competence as well as an understanding of the healthcare system to their bridging role. Erickson acknowledges that patients have needs that the medical community is not meeting, and the traditional methods of reaching these groups are simply not working. In their unique role on the healthcare team, and as trusted members of their clients' community, CHWs can effectively explain concepts and directions that can lead to healthier outcomes. At North Point, the healthcare team includes the patient as well as a CHW, physician, nurse, medical assistant, behavioralist, and social worker. Dr. Erickson notes that CHWs help decrease emergency room visits, hospitalizations, and clinic visits. Anisa Essi, a Somali community health worker, knows she is a valuable addition to the healthcare team. She acknowledges that doctors have limited time to spend with each patient. In her role, she's able to extend a patient's time with the healthcare team and bring a cultural sensitivity to the interaction. It's this combination of cultural knowledge and language skills that add to the effectiveness of the overall team. Essie primarily works with high school-aged Somali students. She leads discussions on HIV/AIDS awareness and believes that her age and expertise help open the lines of communication surrounding potentially stigmatizing issues. The teens she works with may not have the kind of support at home that Essie offers because in many cases their parents are unaware of the stresses and peer pressure associated with going to school and being a teen in America. Her support has proven to be beneficial in helping the teens cope with their new environments in healthy ways. Minnesota is facing a shortage of workers in many health professions, including dentistry, pharmacy, nursing, and medicine, which will have an impact on the state's overall health. To help address this issue and to prepare community health workers for their positions, the Minnesota State Colleges and Universities system has developed a community health worker curriculum, which serves as an educational pathway for minority and underrepresented populations into the healthcare field. The certificate program is offered at community colleges throughout the state. This standardized training helps prepare community health workers for their unique role on the healthcare team and ultimately helps expand and diversify the workforce in the state. The community health worker field in Minnesota has also benefited from the creation of two other groups, a statewide policy council and a peer network. The first is a collaboration of healthcare providers, health plans, post-secondary educational institutions, nonprofits, foundations, and government agencies. The second is a statewide peer network that provides opportunities for community health workers to support and learn from each other. In addition to immigrants and refugees, community health workers also work with other underrepresented communities. Anita Buell is the first national deaf community health worker. She recalls a family who went to the emergency room for all of their medical needs, no matter how minor. They went because of the interpretation services provided at this particular ER. Anita helped this family find a primary care clinic, and they no longer use the expensive ER as their medical home. Latricia Vitaw, a community health worker at North Point Health and Wellness Center in Minneapolis, is known by her clients as the blood pressure lady. Daily, she helps members of the African American community by checking their blood pressure, developing exercise programs, and offering information on how to become healthier. In Minnesota, CHWs and the clinics and organizations they represent open doors that were previously closed to their clients. They provide the critical link that is often the first vital step in getting patients the care they need.